joining us now, guest editor, Dr. Lee Kurisko, and he just had an op-ed in the American Dossier, and he was an invited attendee to President Trump's rollout of his America First healthcare plan in September in Charlotte. We have all been disappointed with the fact that the fake news hasn't covered this. So let's go right to Dr. Kurisko now. Dr. Lee Kurisko, great to have you with us, man.
Thank you. Thanks for having me on.
Hey, listen, you were in Charlotte, the president rolling out his America First health plan, but you look at these debates and you would think that this doesn't even exist. Nobody will cover it. Why?
It doesn't suit the left's agenda to recognize that President Trump actually has a pretty good plan for improving healthcare in America, which is based on movement towards more transparency and more free market principles to decrease cost, increase choice, and maintain a high quality of healthcare. It doesn't suit that narrative. Now, the reason I have been involved regarding healthcare is because my background is that I'm from Canada, and I worked in the Canadian system for 13 years. And
really?
Fairly early in my career as a radiologist, I was medical director for diagnostic imaging in Thunder Bay, Canada. And we faced tremendous issues there with waiting lists and inadequate equipment. Our waiting list for an MRI was 13 months long. For a CT, it was 7 months long. I knew physicians that had 2-year waiting lists. The average wait time in Canada for a specialty consultation is 20.9 weeks. And to get a specialty consultation in Canada, you need to have a referral from a primary care doctor. And the problem is 16% of Canadians have no access to primary care because of engineered doctor shortages. So in Canada, where supposedly healthcare is a right, by having the machinery of government between the doctor and the patient, the net effect is that people actually don't get the care that they need. I mean, it does to some degree keep costs down, but even still, Canada spends is in the top 5 as far as healthcare expenditures in the world, although the quality is poor. And the problem with the Biden plan is that it doesn't address root cause issues for the dysfunction that we do have in American healthcare, in which the doctor and the patient are not connected, in the sense that there's a huge bureaucracy between the doctor and the patient. Mm-hmm. And President Trump's plan is to empower individuals with a more personalized form of healthcare rather than government healthcare, mm-hmm. in which patients control the dollars, either through robust health savings accounts, which could exist in either private plans or within government plans such as Medicare and Medicaid. In fact, Vice President Pence, when he was governor of Indiana, actually built in a provision in the Medicaid program there in which there were health savings accounts in which people were given money that they own, that they control, that they're cost conscious of to conserve and balance, expense with quality. It's unfortunate that the Trump plan has not gotten the press that it should, because it's definitely a move in the right direction.
It's not getting the coverage it should because it would shatter the narrative, which is if you vote for Trump or the Republicans, you're going to lose health care, no pre-existing conditions, everybody's going to die. They've been riding this wave since Obamacare came under fire. And Doc, if you saw the debate last night, when Biden immediately went back to the same talking points, 21 million people are going to lose coverage. They're not going to cover pre-existing conditions. But, when they say coverage, what just drives me insane, because I went through this myself with my own family. If you're paying $1,200 a month in a premium and your deductible is $10,000, you have coverage on paper. You have no coverage, right?
You're right.
And yeah. There's no, I don't know what, you can say I have coverage. If your deductible is $15,000, you don't have crap. So, right. Because right. you gotta do the $1,000 a month premium and then get to the deductible. So you got to spend $27,000 before you're going to get a mammogram done. Give me a break.
Yeah, it's absolutely ridiculous. And firstly, President Trump, I actually stood in the room in his presence when he said he will veto any legislation that does not cover pre-existing conditions. So for the Democrats to say that he is not dealing with pre-existing conditions is it's just not true. And as far as coverage goes, those 16% of people in Canada that have no access to primary care, well, they've got a little card in their pocket saying that they got health care coverage. But, with a Biden type plan with, increasing subsidies to Medicaid and expanding a public option, the public dollar will start to squeeze out the private dollar. And as it stands right now, the private sector actually subsidizes the public sector. We were just had a business meeting yesterday evening in which our financial guy was going over some numbers, and he mentioned some procedure where the private sector would pay $87 and the Medicare was only paying $30-something. Well, basically, so the private sector is offsetting the public sector, and it's interesting. I have a friend in New Jersey who's an internist there, and she was getting squeezed out of business by the Medicaid, couldn't keep the doors open, opened up a private charity clinic. Mm-hmm. And apparently to be seen under Medicaid in the local emergency department, it's about $1,600. If you're seen in a federally qualified health clinic, it's about $500. To be seen through charitable care was $13. And so what they did is they moved, they started covering the indigent patients with their charity care in a clinic in their church basement. Because the Medicaid pays so poorly. But my point is that with the public sector dollar squeezing out the private sector dollar, the Biden plan will be an incremental move towards a Medicare for all program like they have in Canada, which is highly dysfunctional.
Well, I mean, look, a couple of things. And by the way, we're with Dr. Lee Kurisko, part of the Job Creators Network. For more information, you can go to healthcareforyou.com. That's healthcareforyou.com. Dr. Kurisko, what is so interesting about this is Biden says, I want to go with the public option, give everybody the option. Well, I mean, Medicaid pays, and Medicare, they pay 60% of the average market rate. So the more people you add to this, I mean, all it does is it lowers the amount of revenue available for those hospitals and doctors that can't survive on 60%. So it just keeps raising the price of the private care, and it's designed to basically collapse the private system. I mean, that's what the public option is designed to do: collapse the system, so that you have to go to a single payer system, and then you get what you have in Canada. I mean, so to say I want to do a private option, I mean, a public option is so stupid because it just keeps driving everybody in that direction until everything collapses. Tell us, when you were a physician in Canada under their plan, what drove you out?
Just absolute frustration. Just absolute frustration that I could not partake in good quality care. I actually got to the point I couldn't sleep at night. I had this waiting list for MRI that was 13 months long, and I would try to triage it and decide who needed to be done more urgently and who could wait. And that was difficult to do. We were so busy that I didn't have a chance to call every physician and get more details. So based on a 1 or 2 line clinical history, I would decide who would wait and who would be seen sooner. And from time to time, I would read a scan several months after I triaged their request, and there'd be a huge tumor or rampant out-of-control infection that should have been addressed months earlier. Mm-hmm. And I had personally sent them to the end of the line. And I just couldn't sleep in that under that sort of a circumstance. I felt it was morally reprehensible the way the government had claimed a monopoly on the provision of health care and would impede people from getting the care that they actually needed. So that's why I left. It was just total absolute frustration. And the interesting thing is, healthcare in Canada is more driven by budgets rather than profit. And profit is often seen as a dirty word, but it's really a way of figuring out where capital needs to be allocated. And I'll give you an interesting example. We were shorthanded. In our area, we needed 13 radiologists to not be shorthanded, according to the Ministry of Health. For a while there, we had 3, and we were being worked to death. There was at that time we didn't read everything on computer. It was the actual hard copy films, and I said, well, if you want us to get this work done, we need to get this device called a roloscope, where a clerk loads the films onto this machine, where you just push a button, you go from case to case to case, and it maximizes efficiency because you're not having to take films in and out of folders. Well, it took I made a request to the hospital. They said, well, we have no money in the budget. Make a request to the Ministry of Health 700 miles away, and maybe they can dispense some extra funds for that. Well, I mean, I was so frustrated I left, but 3 years later, the radiologist finally got the roloscope. And then they realized that it was of no function because no one would pay to have a clerk load the films on. So it collected cobwebs for another year. Meanwhile, I was working in Minneapolis area, and we were getting busier and busier, and my partner decided, hey, we need a roloscope to get through all this work. Well, we approached the hospital, we approached our group, and within a month we had a roloscope. Why? Because it is a relatively more market-based system here in the United States. It made sense for us to have a roloscope, spend some money on that, have someone load the films, and so that we could work fast and efficient, deliver high-quality care promptly, and be competitive with other hospitals in the area. And it just shows you the difference between government control versus more of a private control. Now, certainly the U.S. healthcare system is far from a paradigm of capitalism, but there is certainly more inclination to respond to the potential for profit, which I say is actually a good thing. Mm-hmm. I'll give you another crazy example. This goes back a few years. My brother was sick, my own brother, and he was having symptoms that were very suggestive of nasopharyngeal cancer, which is a rare malignancy in Caucasians. And I had to tell him, you've got these symptoms. You need to have an MRI of your head and neck. Mm-hmm. And being stoical, he didn't come down to the States and get MRI done, as I suggested he did. But it was about a year before he actually got the imaging done. And he got it done, and I was told that the report was that it had shown sinusitis. I just flat out didn't believe it. I got on the plane, flew to near Toronto, and looked at the MRI myself. I said, my brother's got nasopharyngeal cancer. Mm-hmm. And I told my brother, I told the internist, and the internist said, that makes so much more sense. So he waited about 7 weeks to get his quote-unquote emergency chemotherapy and radiotherapy because the diagnosis was so prolonged and delayed. I mean, the tumor was very, very extensive. And long story short, he ultimately did succumb to it due to complications from the treatment because he had to have such extensive radiotherapy and so on. But the thing that was just absolutely starkly demonstrative of the private sector versus the public sector is that when he really got sick, it was Christmas Day, and his kids were young at the time, and he had to go to the hospital. And I had said, don't go to the hospital in your community because you need an MRI, and there's no MRI in that hospital, despite the fact that it's a town of 85,000 people. Now, mind you, there's an MRI for pets, but none for people. So I said, go to the hospital 15 miles down the road. They've got an MRI. So he got seen there, but it was Christmas Day. It's like, we don't do MRIs on Christmas Day. We don't have any money in the budget for that.
Unbelievable.
Now, my dad was a retired judge, and he just was visiting, and he just raised the roof. And he managed to get an MRI the next day on Boxing Day, which is still a holiday in Canada. So anyways, my brother had this diagnosis, which I made, and I was visiting with him and spending long hours in the hospital. And here he was in a Canadian hospital, could not get access to the care he needed. But meanwhile, at any time of the night or day, I could go down to a Tim Hortons kiosk and get a nice sandwich and a coffee and a donut or whatever at any time of the night or day in a Canadian hospital. Well, what's the contrast? Tim Hortons was functioning on a capitalistic system in which it was, allocating resources for coffee and donuts based on the potential for profit, and yet the hospital was functioning on a socialist model in which they were functioning out of a predetermined budget. And so you could not get the care you need, but you could get extraneous things like coffee and donuts and a sandwich at 2 a.m. And Canadians are blind to this. They have been so brainwashed about the supposed perils of the evil capitalist U.S. system. But I have never seen anybody in my 18 years here in the U.S. be turned down for health care. I mean, they do, by and large, get taken care of. And denial of care in Canada is far worse than it is in the U.S.
So, Dr. Lee Kurisko,
I'm very passionate about stuff.
Your peers, your colleagues in Canada that are physicians, that are doctors, surgeons, that go to school and they have a passion for helping people. I mean, every doctor I know, you don't just get to be a doctor because you figure that's a good job, right? You have a passion for this, for serving people. Yeah. I mean, how do they just deal with this system in Canada? Like, how do they deal with it
but people just suffer and they just wait. And like, for example, my mother, she's 91 years old. She's having some issues. that have been dragging on and on. She needs an MRI of her back and potentially an epidural steroid injection. This has been going on for months. I mean, she's not even been able to get on a list to get an MRI. Whereas here in the United States, I mean, we get stuff done so fast, it's unbelievable. We get angry phone calls if somebody's waiting 40 minutes for their CAT scan report. But whereas in Canada, I'll tell you a story. My dad, many years ago, he had an expanding mass on his knee, and he needed to get an MRI, and he was going to have to wait a long, long time. I'd moved down here, so I called the secretary up in Thunder Bay, and I sweet-talked her, and he got in within a couple of months. So he got his MRI. It was May. As he was getting off the table, the technologist said, "You'll get your report in September. Contact your doctor in September." Well, and this was in May. Can you imagine the United States, people waiting like that? But I think what it is a cultural thing. I think it's a brainwashing thing. I grew up in that system believing that the Canadian healthcare system with government healthcare was sort of morally superior to the U.S. system, and that in the U.S. people were just left to die in the streets, but it's just not true. So it's a brainwashing thing. It's sort of the slow boiling frog thing. The waiting lists get longer and longer. In Canada, the old story about you put a frog in the boiling water, jumps right out, but if you put the frog in the water and slowly turn the heat up, it'll boil to death. That's sort of how it is in Canada, and it's just become normal, and people suffer, and somehow people see this as acceptable. And I really think that people have been brainwashed. And, I don't think that Americans will accept the transition to a system where they just can't access care. I think that they'll be on the steps of the Capitol with pitchforks and torches if that ever happens. And so I think that the Trump plan towards more choice and lower cost and high quality is a good plan.
All right. I want to thank Dr. Lee Kurisko for being with us. Great segment, Dr. Kurisko. We have to have you back because you have a unique perspective having practice in Canada under the system that Biden care wants to bring to America. So thank you. Thank you, sir.
You're welcome.
John,
my pleasure.
Thank you
Very much.
Outstanding segment. John Fredericks Radio Network.